It is my pleasure to introduce Senator Barbara Boxer of California.
For decades, you've been telling me that there are not enough nurses, especially in hospitals, and study after study shows there's simply a national nursing shortage. By 2020, it is estimated that the demand for full-time nurses will exceed supply by 1 million nurses. And this is unacceptable. We must address a problem that affects quality care, and we have to address a problem that is driving too many nurses away from the hospital bedside. There's just so much, a person can do. And I know just caring for family members when they're really sick, the toll it takes on you. And we don't want nurses to become deadened to the whole humanity thing. And if you're so overworked, it's not going to be good for you or the patients, that's for sure. So I am pleased to announce that I have introduced the National Nursing Reform and Patient Advocacy Act. We're very excited. Yes. It's exciting. And what I want to say is, what I want to say is thank you for asking me to be the author. You understand? It makes me proud. And this bill will not only help address the nationwide shortage of skilled nurses, it will improve the quality of health care for all Americans. The legislation champions nursing rights, nursing ratios, and nursing reform. And I would argue this legislation represents patients' rights as well. Yes, because this bill protects the rights of nurses to speak out for patients and to speak out for themselves without fear of discrimination or retaliation. If there is a problem in your hospital, you should not only be able to talk about it, but you should be able to do something about it. That's part of your job, and you shouldn't be punished for doing the right thing. So, second, this bill sets minimum nurse-to-patient ratios because patients will simply not get that high quality of care if nurses do not have the time to provide it. It's a no-brainer. It's very, very simple. We understand if you're running around and have all these problems, you're just simply not going to be able to give the care that you want to each patient, and the patient can suffer mightily because of that. And finally, what this bill does, it creates a registered nurse workforce initiative that invests in the education of nurses, and because we know that medicine, just like more than almost anything else, is changing every day, right? And what was good practice 10 years ago is not good practice today. And now with all the technology, you have to keep up, you have to almost be an engineer today to do your job. And therefore, you need the training.